I think it's great to follow these two experts now in a discussion which we call Fireside Chat. It will be moderated by Dr. Young and will take 20 minutes, roughly, and we may take questions afterwards. If you do not want to use Slido, you don't have to, of course. You can also raise your hand, and we've got microphones. Come with you, and you can raise your questions just in front of us. First questions came in. We will do it after the Fireside Chat. If there are any more, we're happy to answer them. But now, the floor is yours.
Well, thank you very much, and wonderful presentation. It's probably not surprising that I agree with everything you said. It's very difficult to do. I mean, in order to evaluate programs, we need to have common measures so that we can speak the same language. Even though the measures may not be perfect, sometimes the standardization of those measures is almost more important than their perfection, because we can at least look at changes. Do you have any ideas about how we might try and encourage more standardization across the different surveys?
Okay. Thank you very much. I enjoyed your presentation very much too. And it's really nice to see that Cyprus is already moving in this direction. And I think you mentioned that hopefully that will become more of a trend. Now, as we discussed earlier, there is no real stick that we could use to force the countries to actually standardize the measure. So my hope is that the regulators, the national bodies, will actually appreciate the benefits that would result from such a harmonization. That it's not just that, oh, we don't want to do it because of cultural differences or because it's too difficult. Because we have ways in which it has been proved that can happen, and it's happening. So we have the pan-European surveys of children on lots of different activities, which is administered and works very successfully. So it shows that it is possible to coordinate. The question is whether there is enough willingness to do it. Mm-hmm. So what I'm trying to do by presenting and talking to people and advocating for it is to encourage the conversations to be taking place. For the regulators to speak to each other, for the relevant parties in the national ministry. Not all countries have specific regulatory bodies. Some of it is part of the national ministry responsibilities. To actually be more open and talk more, not just as to why we don't want to do it, but what benefits would accrue to everyone, including them, if we actually started doing it. Mm-hmm. So I hope that by doing that, we raise awareness of the benefits of it. And I'm not sure if there are any other ideas that you have that would help with promoting the push for harmonization.
Well, I mean, one of the things that comes to mind as you think about some of the things like the ISO, International Safety Standards, or things like that. You know, there's a lot of benefit to an organization to be able to say they're ISO certified. Is there a way that maybe regulators or others interested in this area could get together to kind of talk about and decide upon core indicators of gambling harm and problem gambling and in prevalence surveys? And then if you include those measures in a minimum kind of way that allows it to be comparable, you could almost brand it as a certification of standard survey methodology. It would need a marketer. That's not it's a terrible name for it, but if you know what I mean. So that might be an option for sure.
Potentially. I think what we need to think about is looking at it from a slightly different perspective, step back. What are we trying to achieve from the surveys? What are they for in the first place? So in many ways, the surveys is definitely an excellent fact-finding what happens as to how many people engage in gambling. They are pretty robust in determining how many people are potentially at risk of gambling-related harm. What the surveys don't tell us is why it happens, and perhaps an additions of methodology that would drive into these directions would help. But even without that, we're doing it because we want to reassure ourselves, and the regulators, the politicians, will want to reassure themselves that the methods of the Safer Gambling Initiative, the social responsibility packages that are very different across different jurisdictions, are effective and are successful. And in many ways, there is so much disagreement across jurisdiction as to what social responsibility package is important, which should be introduced, which are necessary, which are perhaps less successful. But all the assessment is based on national data. There is no international comparison. Whereas if we could have a more standardized measure, even if it was just the core basic part, not necessarily the full details, then it could provide a significantly more robust evidence that specific intervention has or hasn't worked. And if you have something, let's say, introduced in Germany. Germany had a major overhaul of the system recently. We have the Netherlands that is currently in the process of introducing lots of different measures. And then we have other countries that had introduced social responsibility measures a long time ago, but are adjusting it. In UK, white paper is changing some of it. If we could then see how it works and compare it through our international tool, then it would really be significantly more convincing evidence-based, at least in my view, than what we currently have.
Yeah, I agree completely. One of the things that is always interesting is when we think about some of the safer gambling measures is, what do we really mean by that? And do we mean that just fewer people enter into the condition of problem gambling, or do we want to put in place policies, procedures, interventions that reduce gambling harm within the population? And then we get to a measurement question about how do we measure gambling harm. When I mentioned briefly during my presentation the lower risk gambling guidelines. So the first thing that we had an international committee that got together, and the first thing we asked was, lower risk of what? When we think about trying to tell people don't gamble more than you can afford, don't gamble too long, think before you bet, why do we tell them that? The idea is that we want to make sure that they are less of a risk of harm. I came back into the gambling field after working in alcohol and substance use for a very long time, and one of the interesting things is I noticed that in the gambling space we talk about the risk of problem gambling. Whereas in the alcohol field, we don't talk about the risk of alcoholism. We talk about the risk of stomach cancer, the risk of injuries associated with consumption of alcohol and driving, risk of a whole bunch of things that we know are associated with alcohol consumption. Gambling, I don't think, has evolved to that extent, and we still simply use this one measure that measures a very small proportion of the population that happen to meet that definition. And because that's oftentimes in response to underlying issues like mental health challenges, things like that, that number doesn't change all that much in response to interventions. The other indicators, so I'd like to ask if you have any ideas about harm measures, because if we had better, more sensitive harm measures, we would be able to better and more, these measures would be more sensitive, and we would be able to measure the effects of our interventions with much greater precision.
Yeah, absolutely. Again, perhaps it's not surprising that I completely agree with you on that. It's interesting because in UK Gambling Commission is working on gambling harms in addition to the problem gambling measures per se, and that it's something that is being introduced into the actual surveys. Gambling harms are a bit more complicated because as we kind of look at it with other substance addictions, alcoholisms and others, they tend to be significantly more outward and perhaps easier to assess objectively. If you're talking about stomach cancer, you're talking about A&E admission, the number of accidents that may happen on the road because someone is drink driving, or similar ones. Those are objectively verifiable measures. They don't rely on self-reporting of people to say how much they drank or what harm they caused them. And yes, you can have some really acute instances of gambling problems where I don't know, someone gambles away their family home or their mortgage money. And that could potentially be objectively measured through gambling bankruptcies or other problems. But that would be only at the extreme sides, and I think that would be too narrow. And we would need to find a ways of making an objective measure that perhaps captures not just the extreme harms that could be easily identified externally, but also the harm that are at the lower level, like people not necessarily gambling their home away, but then not having enough to provide proper nutritious food to their family, or spending things that they were supposed to be from family holidays, and then it's just going on gambling.
Yeah.
And
arguments
that sort of
with spouses
activity.
and things like that. Yeah.
Absolutely.
Yeah, I agree. I'm wondering if there was any questions, because I recognize we're at the 10-minute point, and I was going to check in with our wonderful moderator at around this point to see if there was any questions.
That's a good idea. No question.
There's at least one question, and it's about player protection. It's about the gamblers can be at moderate risk just by being blamed by others. That is outside the effect it has on the gambler themselves. Doesn't that mean that if attitudes in population become more negative, if these severity scores, these severity index scores, get an increase unrelated to actual harm? No measure is perfect, it's just a point to note. So would you like to comment on this? My understanding is that just because probably someone else, not the player himself, is going to exclude someone, the player, it could have some impact on the analysis and maybe the research finding of these indexes.
Okay, do you want to address it?
So I'm not sure. So most of the surveys that I'm aware of, and I believe that some of the surveys that you were talking about are self-report from an individual's perspective. They're not talking about harms experienced from another person's gambling, although that is a significant issue. Anybody who does gamble problematically, they're not the only person that experiences harm from that. Usually their families are also affected. So I'm not sure if I'm answering the question right, but certainly all these survey questions are asked to individuals who report on their own gambling, not somebody else's.
Right.
Yeah.
I think this was about the problem gambling severity index.
Yes.
And I think that answers the question. Thank you very much. There's another one. The European Committee of Standardization, CEN, is dealing with standardization of the markers at harm, a topic we will touch on later as well. Largely industry-based, regulators are moderately involved. Would you like to comment?
Can you repeat the question?
It's more a comment, but it's probably about if you can agree. The message is the European Committee of Standardization is dealing with standardization of the markers at harm, largely industry-based. Regulators are only moderately involved. This is sort of an analysis. Could you confirm whether this is your anticipation as well?
If I understand your question correctly, and I do apologize, but we have quite a lot of echo here, so we may not fully understand what is being said. There is a lot of initiatives now that tries to understand what markers of harm really are, that are independent to the screening tools that we have been talking about. And for example, one of the important markers of harm is expenditure, but not expenditure in an absolute sense of how much money people spend on gambling, but expenditure relative to the respective income. And there are many other potential markers of harms that can be identified. Now, the issue here is, first of all, on agreeing what the markers of harm is, and my understanding is that there is still quite a lot of disagreement across different states, different regulators, as to what the appropriate objective markers of harm really are. And secondly, even if those markers of harms are identified, there would have to be a way of measuring it, not necessarily from a self-report, because self-reports suffer from the inherent unreliability problem, but is there a method to measure those markers objectively? And with online gambling, for example, one way of doing it is to look at the activities online. We talked about artificial intelligence. Artificial intelligence has enormous capacity to identify problematic or risky type of gambling that someone may engage in. The difficulty then comes with GDPR and the fact that data protection is very strong, and rightfully so, and people do not necessarily gamble on one online website. They don't necessarily gamble with one gambling operator. They don't just go to a land-based casino. And a lot of people engage with multiple forms of gambling. So kind of trying to reconcile all those things, it's very difficult. And this is an enormous project that would need to be undertaken and is being undertaken in order to come up to some sort of an agreement that then all jurisdictions would be happy with. I don't know whether I answered the question, but hopefully.
Matthew.
It may be important just to think about the credibility of the core measures as well. So there are lots of organizations that will do a very, very fine job doing that, but it's really important that any kind of conflicts of interest are wed out. So I think having a board that may have be coming from industry may not necessarily meet that criteria. It may be more important that regulators or a board appointed by regulators of academics who can look at this issue without any kind of influence or perceived influence from the outside, so that they can come up with a core set of measures based on the evidence that it's above reproach and cannot be criticized. I think that's probably important. So the only thing to mention to that would be there may be the choice of the organization to come up with a set of core measures. I think is an important aspect to carefully consider.
Right. I think that's important to be pointed out. Due to the running out of time, we may have one more question, and it's the one that's obviously attracted the attention of more of only one delegate in this room. Although you slightly answered this question, I will raise it again. It's, can there be a universal definition for gambling harm for all regulators, and how can we take into account the different geographic, economic, and social differences? I think that's one for you, loving standardization and trying to unify things, but you can both comment on it. And
I happily answer it, because the geographic and cultural differentiations is being raised very often. And while I accept that there are cultural differences, and I don't deny that in the slightest, I don't think human beings per se are very different. There are some differences, but there are a lot of similarities. And even when we're looking at the gambling harms and we're looking at problem gamblings across several jurisdictions, not only within the European Union or European countries, but across Canada and Australia, actually most of the measures are quite standardized, and they're just not being used in a standardized way. So I think there is quite a significant way to go, that we could have both best parts of the world, that we could have the core ways of identifying what the gambling harms are that are generally applied to most human beings, regardless of their nationality or where they are based, and then have additional questions that would more personalize and take into account the elements that perhaps are specific or unique to the country. But then it comes to the personalizations of the measures themselves. So with gambling harm, for example, and financial expenditure, for some persons, spending 300 euros per se, for example, in a week may be nothing. And that's not a necessary indicator of harm from them. For another person, spending 300 euros in a week on gambling could represent half of their household income for the week, and that could be problematic. And that wouldn't necessarily have to be lost in the harmonized measure. It just would be a reflect of the different income streams and different attitudes of people in different jurisdictions. I don't know if you would like to add something to it in the 32 seconds we've got left.
I'm sure you will.
There is a growing consensus among gambling studies that there are sets of harm that are consistent across cultures. There will be some variation in how they present, but the actual harms are fairly consistent. The largest ones for certain are financial harms, relationship difficulties, a personal stress associated with gambling. So these harms are fairly consistent. I agree completely with the idea that you need a core set, and then you need to be able to then customize it for the culture. We see this, and gambling's not new to this. We've seen this with alcohol. There's very different drinking cultures in, for example, between France and New York City in the U.S. The cultures are very different, but in many ways, the harms that arise from alcohol are similar enough that you can come up with similar enough questions to still get at that, and that will also not only acknowledge the cultural differences, but may even help to understand those cultural differences and how they play out in the expression of gambling harm.
Thank you so much. Yeah. I could follow you endlessly and could continue this discussion, but unfortunately it's time for a break now. It will be a short coffee break. Can we say around 15 minutes so that we all be seated maybe at 11:55, and then starting the panel sessions. First topic will be dealing with advertising. I hope you enjoy the break, the coffee, and the talks, and see you in 15 minutes. Thank you very much, and thanks to the wonderful Fireside Chat panelists.